Dyslexia, as we all know, is a reading problem, and approximately 15% of the school children in our country, they suffer from this.
So children with special needs, especially with the problem of dyslexia or dysgraphia that we have been considering, we need to be extra careful when because they're getting the practices on their own.
Mostly these are the kids who have difficulty in terms of age appropriate learning. They have difficulty reading, and the most common format in which it would appear to the teachers or to the parents is when these kids would have difficulty writing the letters. Now what we knew from the studies is that all these kids, they have problem with their M cells, the magnocellular pathways in the brain, and this pathway plays an important role because it helps you integrate the visual and the auditory inputs. These kids have great difficulty because the geometric pattern that appears to them visually and the sound that they hear, normal kids are able to sync these two inputs together, but because of the problem with the M cell pathways, these kids have problem with that.
As far as dyslexia and dysgraphia is concerned, what we do is called remediation. The remediation in simplest term is trying to find an alternative route of teaching.
Earlier what we had done in one of our studies, we had looked at how these kids look at the world with the matras in Hindi and without the matras. And then we looked at certain formats to realize that if these kids are given audio and visual feedback, their performance increases. This was one of our papers earlier. So based on this, what we decided was that we would develop an app which would actually help understand the kids decipher the geometric pattern of the letters. So our idea behind developing ADCAD was to develop a assistive touchscreen based device which would enable reading while the child gets a visual as well as auditory feedback. And because it was a touchscreen based device, thereby the child would definitely use one of the fingers to trace or write. And therefore, auditory, visual and haptic, three sense modalities of the body will sync together.
So that way, making an interface which is simple, direct, very soothing for the eyes, where the children already complain for jumping letters and dancing words. There are also mirror images and many other difficulties that the children of like this class 1 to 5, the user group that we have been considering, they go through.
So right from level 1 where the child has had to trace with the help of the finger, to the second level where the assumption was that the geometric pattern of the different Hindi alphabets are now clear and the child can arrange them because he or she has the mental image of that very letter, to the format at the third level where you take independent letters, arrange them to create meaningful words. So this is how ADCAD was designed.
The interface was basically made for the use of people who are including the parents also, because they're often substituting the helpers, the remedial teachers who are often unavailable. There are very few experts who help them out.
And once we designed the ADCAD, we went back to the same kids whom we had initially included in our study for assessment, and at the second time when we went, it was for user testing, and it has given us the most satisfying result, because within 2 weeks we realized that all children who are suffering from dyslexia, they can overcome marginally in the beginning and substantially later on after a practice of 2 weeks. based on our clinical experience and based on the success of this assistive device, I strongly recommend the schools to have ADCAD in their as one of the facilities there, because you will be helping the child like anything. All children who have problem with reading, writing, even with disorganized handwriting, all of them will get benefited out of this.
At the end of it, if I have to sum up, this is just a deficit. It's not the whole human being. So these kids should be allowed to explore life and find out their niche in the world.